Well, good morning and good afternoon, depending on the time zone where you're in. My name is Nienke Stam. We're hosting this webinar today together with Miro, Proparco, and FMO, partners of IDH. We'd like to start now. I see something slightly going wrong with the screen, so let us resume. There we are. Excellent. So welcome everybody. Maybe I can first give the floor to my co-host Gretchen of Miro to introduce himself.
Yes, hello everyone. Thank you very much for attending this second webinar co-organized by Miro, IDH with FMO and Proparco. My name is Gretchen. I'm director for the LDN Fund. And yeah, we are really looking forward to discussing more concrete action taken to halt the spread of COVID and find concrete solution to continue businesses on the ground in this difficult time. And we hope this webinar will be helpful.
Thank you, Gretchen. As said, my name is Nienke Stam. I work with IDH, a sustainable trade initiative, working on promoting sustainable supply chains and sustainable landscapes. Within the team of the landscapes, I had our team on landscape finance. And that team partners with sustainable land use investment organizations like LDN Fund, but also at times with Proparco, with FMO and others, to promote investment in more sustainable land use operations in the agriculture and forestry space. We organized our first webinar 3 weeks ago, and we had over 800 people register at the time. So this was quite overwhelming, and out of that webinar came a solid request for a follow-on. So this is actually the second webinar that we're hosting today. But before we start, I just want to quickly draw your attention to the tools and resources of the previous webinar, where David Nabarro, a special envoy of the WHO, spoke on the role of private sector companies in COVID-19. There was interesting analysis shared by the FAO on food supply chains affected by coronavirus. But also very practical lessons were shared out of the Ebola crisis in Liberia by a team of experienced operators that were there at the time. And also a number of companies, including Forest First from Colombia and Miro Forestry, shared measures that they were already taking at the time. Those materials were also translated and they're available also in Spanish and French on our website. I've included a link here below, so if you're interested in looking those up, feel free, and of course we'll also be circulating the slides of this webinar shortly after today. Next slide. Yeah, great. So let me briefly introduce the agenda. We'll be talking about 3 topics today, which is business continuity planning, operational health and safety during COVID-19, and then a panel discussion block around communication and outreach to smallholders and local communities out of sort of nucleus farms or agriculture and forestry operators. And the speakers we have today are mainly representing private sector, but also a number of experts. We're very grateful to have Anish Jain, Chief Treasury Officer of Export Trading Group, Gary Rynhart of the ILO, talking about business continuity planning. Then in the second block, we have Gretchen Blake of MTO Group, a forestry operator in South Africa, and Teddy Deroy of IBIS Consulting. And then in the final block, we'll have 3 companies and 2 experts reflect and share lessons and interact with each other on how to communicate with communities in such a way that it leads to actual behavioral change related to operational health and safety and such measures. So that should also become very insightful. Then without further ado, let me hand over to our first speaker, Mr. Anish Jain. He's Chief Treasury Officer and Head of Corporate Communications and Marketing with the Export Trading Group. This is actually a group that is active in agricultural trade, but also has a number of processing facilities. They service smallholders and agricultural companies in Africa, Sub-Sahara, and they're operating in 27 countries. Anish, I hope with that I can hand over to you.
Thank you, Nienke, and good morning, good afternoon to everyone based on time locations you are present. I hope that everyone is keeping safe and doing well. I'm really glad to be present at this webinar today and share some of the insights how ETG is planning the activities in these times. I will request Katie to just put together our slides of presentation. Meanwhile, the slides are coming up. A quick introduction about ETG. We are primarily an agricultural supply chain manager company. Globally, we are present in 51 countries. As Ninke mentioned, 27 countries in sub-Saharan Africa and some 24 countries outside Africa. We have supply chain activities which spans across buying the activities and produce from smallholder farmers and managing the supply chain, processing these commodities at our own processing plants, and then taking the finished products into the destination markets. In total, we operate more than 120 processing plants across different countries. And as you can see on my slide, we have around 95 facilities across Africa. These are basically processing plants where we process different kind of commodities from cooking oil to puree, pasta, noodles, processing cashews, and also blending fertilizers and agrochemicals, which are one of the essential inputs to the farmers across Africa. If you move on to the next slide, some of the most important activities that we have to make sure that our operations will continue. The first section definitely is about procurement and sales planning. Since we as an organization buy more than 6 million metric ton of commodities across Africa, it is very important for us to make sure that how we partner with government and the cooperatives across Africa to make sure that these times we are keeping the safety of the people first and continue managing our operations. So some of the initiatives that we have taken is to, first of all, work directly with the governments in various African countries and set up some safe procurement hubs. This essentially involves setting up those locations where farmers can send their products and companies like us can buy the product in a safe environment without having a lot of people herding into one common area. The other initiative that we are working on is to create online marketplace for e-auctions. This essentially involves having farmers sitting far right in upcountry locations, but they can offer their products through aggregators or directly through the platform where the company can offer them the price. Based on a specific quality, we can buy the product. We have already done some testing of the app, and some pilots have been conducted in Kenya and very successful results so far. Due to the time constraints, we are trying to ramp up it, and hopefully by the time the procurement season will start in May and June, this will be fully functional. Next initiative that we have taken is to coordinate with local procurement markets. This is basically the function of working with cooperatives where you help them to aggregate the stocks and bring it to the destination markets where we can procure. This way you will see there's a lot of initiatives are being taken. At the same time, on the logistics side, we are trying to manage working with the in-house logistics as well as the contract logistics partners and get the permits from the government to operate our logistics and supply chain operations. This essentially involves having a lot of initiatives across multiple countries where you need to make sure that people are safe and you give them safety briefing before they operate. This also involves having strategic alliances with shipping companies for availability of containers and very close coordination with port authorities to make sure that the vessels are still berthing and they are clearing the cargoes. So with these few initiatives, I would just like to move on to some few slides which I have put together about initiatives that we have taken to make sure our employees are safe. So firstly, we have organized multiple safety briefings at each of our locations, as you can see on the left side. And on the right side, you will see that the notices are being put on each offices to ensure that workers, drivers, people working at the processing plants, they are fully aware what kind of precautions they need to take. If we move to next slide, you will see that how we are doing the personal protective equipment distribution to our people, making sure that they follow the hygiene procedures. All these images are coming directly from our plants in Africa. Just to highlight, as an organization, we have imported more than 2 million gloves and masks to be distributed to our employees and make sure that they are complying with all the WHO safety guidelines. Moving on to the next slide. This is basically, we have installed disinfection packed passages at our plants. If I can just play this video, which is mentioned on slide 5, it will give you some idea that how this passages looks like. Can I request? So these are the custom designed passages that our sustainability team has designed, and we have installed these across different plant locations and office locations in Africa. These are typically costing only around $1,800 each passage, but it gives a lot of comfort to all the employees who are coming into the plant to work at these times. And another initiative that we have taken is to make sure that we have taken additional insurance covers for our employees as a protective. So this is basically a $30 insurance, which gives a $30,000 cover to our workers who are working at the plants and operations. Moving on to the next page. These are some of the images of training that we have conducted along with local civic authorities as well as WHO. To provide safety and EHS guidelines to our people at different plants. Moving on to the next page, you will see that these are some of the activities that we have done for local communities across different countries in Africa, where we have distributed foodstuff to local communities and organized makeshift arrangements for medical facilities. If you move on to the next page, you will get to see that communication is very important for us during our challenging times. For internal and external communications, we have started a new campaign which is called ETG Positive Together to create a healthy environment and harmonious balance for work life for each employee who is working from home, and especially people who are going to plants in these challenging times. If you move on to the next page, these are some of the flyers and communications that have been circulated to people, re-emphasizing the Positive Together campaign, just to make sure that everyone is keeping safe and keeping the high spirits. Yeah, I think that's all from my side. This is basically a reflection of what we have done and how we are managing these environments. Very happy to take up any follow-up Q&A from anyone. Sorry for the short time. I had to rush through some slides, but I hope I have been able to communicate some of the key initiatives.
Great, thank you. Thank you very much, Anish, and insightful slides. Maybe as a first question, as a company, how are you expecting to be affected in terms of your procurement work in the coming 3 months?
Very good question, NK. What we expect that procurements will be very tightly monitored and managed during next 3 months, where governments, most of the African economies have a very high contribution coming from agricultural sector. So certainly they will not stop the farmers coming to the markets and selling their produce. Otherwise, the post-harvest losses will be quite high. So they are working along with companies like us to create safe procurement centers and where we can buy. At max, there will be a deviation of 3 to 4% of total crop size, which may not be able to reach the market. But so far, we see that most of the farmers and cooperatives are coordinating with governments to bring the produce to the market. So I see the impact will be negligible.
Interesting, thanks. And maybe as a second question, because you're operating in 27 countries in Sub-Saharan Africa, what type of spread do you see?
The spread is actually minimal, except the exception of South Africa. Most of the countries where we talk with them regularly, whether it is Mozambique, Malawi, Rwanda, Kenya, Tanzania, or even the countries in West Africa, they are still in single digit or double digit expected cases that they have observed so far. Yesterday only I have spoken with our country head in Malawi, and they said the government is planning to take out the lockdowns. They are planning to open up starting tomorrow for a few days. So this basically demonstrates that these economies cannot have lockdown period for a substantially long period of time. More importantly, they do not have the medical preparedness in many countries to fight this or combat this COVID. And we are playing our role in distributing the test kits as well as hand gloves and masks along with the government. So I do not expect that there will be a very high spread of COVID in Africa. There are primarily two reasons. One is the immunity of African people is generally higher than rest of the world, and this is my personal observation. Second, the distancing that we have seen in Africa, a lot of villages are quite distant in up-country locations. It is not very dense and overcrowded as we have seen in many other Asian and European countries. So my expectation is that it will be a mild spread. It will not go as wild as we have seen in the US and in certain parts of Europe.
Great. Well, thank you very much, Anish. And I'm seeing a lot of questions around sharing of the slides, sharing of materials. So participants, the slides will be shared with all the people that registered for this webinar, and also will include links to additional materials. So rest assured there. Well, with that, I would like to thank you very much for your contribution, Anish, and move on to our next speaker, which is Mr. Gary Rynhart. He is ILO Senior Specialist, specialized in training of small and medium enterprises. And as we, of course, understand in the supply chain, multiple types of organizations play a role, and SMEs equally need to prepare for COVID-19 and mitigate impact. Gary, the floor is yours.
Thank you, Ninka. Audio is okay just before I start?
Excellent.
Yeah, everybody, yeah. Okay. Well, good morning, everybody, or good afternoon, depending on what part of the world you're in. For the 5 minutes or so, let me just talk a little bit about what the ILO has been doing in terms of responses to support small enterprises. Before I do that, maybe just to go to the question that we just discussed, the previous speaker, Anish, in terms of threats, pervasiveness of the virus on the continent, and some questions around levels of impact. And there's been a question: will Africa be as badly affected as other parts of the world? And I think the answer is yes. If we look at previous epidemics and pandemics, look at SARS. I think it was 5 months after the first case in China before first case reported on the continent. MERS was the same, and H1N1 virus similarly. So there's a delay in terms of these kinds of viruses, but ultimately the result is the same, that they do come. Now, in terms of the impact, already we're seeing a massive economic slowdown that's very manifest across a number of countries. Within the UN, the feeling now currently is that the economic and social hardship will be the main impacts of the crisis, less so the health, although that obviously will be a significant factor, but it's more the economics and the social impact. And just anecdotally, in terms of how the UN organizes itself, what we're seeing is that humanitarian agencies are much more to the fore in terms of receiving initial funding, in terms of interest of their projects. And I think that's an anecdotal direction to suggest the way we're going. So the economic headlines are pretty dire. The manufacturing sector disrupted, number of garment sectors, and very important to a number of countries like Ethiopia, have dried up. Oil prices, I mean, I think they pay you now to keep it. Terrible news for oil producing countries. Mining across, you know, all minerals disrupted, and obviously tourism, you know, key one for a number of countries, that's ground to a halt. And in addition, you know, some of the big infrastructure projects at best have been kind of delayed. So all of that is terrible news, and the fear is that it could accelerate existing social tensions. Already we're seeing spikes in crime, and politically as well. I think there's a factor here in that, you know, there's a number of countries, Burkina Faso, Burundi, Cote d'Ivoire, Ethiopia, amongst others, that have scheduled elections this year. Now, some of those have been postponed, but many haven't. So it'll be interesting to see how that plays out with opposition movements, and, you know, potentially could authoritarian governments use the virus to stay in power. So there's a questionable variable around that, and lastly also migration, which is basically ground to a halt, and that also has consequences, particularly around remittances. So look, let me quickly move on to SMEs and what you can do. And I think our advice has been, you know, keep it simple in terms of the SME audience. Developing a tool, and we've developed a number of them, that can help a very small enterprise just start to think about this in terms of a process. So what we've developed is a 4P framework. It's the UN, so we have to have acronyms for everything. 4Ps are people, processes, profits, and partnerships. Partnerships also includes, you know, wider stakeholders, governments, and so forth, and looking at the impact across those 4 different variables. And the tool will initially start with an assessment of your risk profile according to each of those 4 kind of pillars. So your risk will either be direct or indirect, and it will be driven by internal or external stakeholders. So, for example, if your production process requires high levels of human interaction or proximity, there's a high risk here, but there's also many things that you can do. You can you can change shift patterns, working modalities, and so forth. The stuff you can do. External risks are much more severe, and they're out of your control. Things like legislative, regulatory environment, freedom of movement, drop in demand, and these are things you can't do. So the tool that we've developed, as I said, very, very simple thing. It's designed around 6 steps. I'll quickly just go through it as time is racing against me. Step 1, identify your key products or services in terms of the share of income they generate, the amount of clients demanding them, and the cost of non-delivery. Step 2, establish the objective of your business continuity plan for your individual enterprise. Is it to maximize the safety of your workers? Is it to be able to resume operations quickly? Is it to ensure contractual commitments, or maybe a mixture of all of those things? But that will be based on your own individual assessment. Step 3, evaluate the potential impact of disruptions to your enterprise. I mean, ask yourself a number of questions. How long can you simply survive? What are the resources required to keep going in terms of your product lines? Step 4, list the actions to protect your business, reviewing ways of working, limiting contact points, changing shift arrangements, all of these kinds of things, developing financial simulations in terms of your costs. 5, establish contact lists and also mechanisms to communicate with all of your stakeholders, whether it's WhatsApp calls or Zoom calls or whatnot, less physical means. And 6, review, maintain it, and continuously update your BCP. So that's it. It's on the slide there, the second slide. You can access that. There's a link there. It's available online, also a PDF version in French and Spanish. I think some other languages are coming. And it's a very simple thing. We're currently working with GIZ, the German Development Agency, on something a bit more rigorous, and that will be, I think, in the next number of weeks. And there's also a second link on that slide just before I finish, for a sustainable and resilient enterprise platform where we channel a lot of these kind of tools, and they will be live within the next few days. Just before I depart, respecting the time you've given me, just one advertisement. Our main transmission mechanism for a lot of our tools is through employers and business organizations, such as chambers of commerce, sectoral associations. The ILO is a tripartite organization, so we have constituents who are not just government, but also coming from the business side through representative organizations, and then on the union side, the worker side through trade unions. So these organizations are a very effective way, I think, of extending the footprint of these tools. And again, they're experiencing a lot of difficulties in this environment, and I think will do. And I think my last plea is for your companies to try and support them as best you can. Anybody can contact me in relation to that. I'll leave it at that. Thank you, Inge.
Great, thanks very much, Gary. And it's great that ILO is making these tools available. And, it's good to increase the spread of them, I'm sure. Maybe before we move on to the next block, there's one question that came in, and that is, how will this pandemic impact ILO's labor safeguard mechanisms? For example, if there would be mass retrenchments, does ILO play a role in these challenges?
I mean, yes, there is, and you're seeing it. And I think the demand from those organizations, the representative organizations, biggest demand is currently around that mechanisms for retrenchments. You're seeing it, handling all the legislative requirements around that. So yes, the answer is that is happening, and there's a demand for guidance, and we're it's probably a thing that we're doing the most currently.
Thank you. Well, again, thanks very much for your contribution, Gary. Again, tools and resources will be shared. And with that, we'd like to move on to the next block in this webinar, and that is being facilitated by my co-host, Gretchen. So, Gretchen, the floor is yours.
Yeah, thank you, Ninka. So yeah, let's move on to the second block related to occupational health and safety during COVID-19. And we have the chance to have two speakers, very active on the African continent. First, Gretchen Blake. Gretchen, you're Chief People Officer at MTO Group in South Africa, involved especially in forestry activities, but not only. I understand you're responsible for a workforce of 5,000 employees across 32 workplaces in 4 provinces. So the floor is yours. You can share your experience, 10 minutes. Thank you very much.
Thank you, everybody. Good morning. Can you hear me?
Yes, loud and clear.
Wonderful. Right. Can we, Thomas, are you able to pop the slides up for me? Thank you. So thank you. Good morning, everybody. Yes, I am indeed the Chief People Officer with the focus on people in our business, which includes all our stakeholders and our employees. So people is our main focus, and I'm going to primarily spend my short time focusing on the people. So just to give you a bit of context, Thomas, sorry, can I ask you to just to flip it for me, because it's not flipping from my side. There we go. So we manage approximately 80,000 hectares of land. We have involvement in forestry. We have manufacturing, conservation, energy, some of our byproducts which we convert into energy. We involved agriculture. We've got a nice focus in the agricultural training space. And with our wonderful forests, we have a really nice little ecotourism business. So we provide employment both directly and indirectly. Quite a fair amount of our operations are contracted out to subcontractors. So we have our own workforce and we have subcontractors, and I'm focusing on that because when we talk about people and some of the challenges we have in around the COVID interaction, we have to consider our subcontractors, and we've included them in all our interventions. If we can move on. Sorry, Thomas, can I ask you to flip? Okay, so just prior to COVID, prior to our lockdown, we already as a business started mobilizing ourselves to prepare for COVID, and we took a focused look at our business. We have got, we prohibited non-essential travel. We had a very cross-functional task team, And we did, as everybody else, started developing our contingency plans, which included plans specifically relating to our HR protocols. What I do need to say is that in South Africa, we've had a large amount of support from the government. There've been ongoing provisions made, which unfortunately have been changing daily. So what is really important is for us to be ahead of the game and to be on top of it. So as the amendments change, as the access to support and systems change, we've needed to be ahead of that. And having a structured intervention and a structured approach has helped us do that. So I think what is more important for everybody right now is just looking at where we're at. We are still in a lockdown phase, and we have been planning, as is everybody else, around how we are going to start up. I think in terms of the context, to understand, we have got our workforce are vastly spread. Sorry, Thomas, if we can move on. I spoke about that previously. We can move on to the next slide. Thank you. There we go. So thank you. So quite a bit of what the ideas that the first speaker spoke about this morning is it's very similar, and our approach has been very similar. But we have started planning how our operations are going to start up, and on the 4th of May, if the lockdown is not extended, the reality is that it is not just a startup with all operations getting going from day one. We have planned a very detailed phased up approach. That phased up startup approach is being managed specifically around the supply and demand. We've got a web of having to look at our logistics and ensure that we mobilize all our partners who are involved with us in being able to start operating and trading. I think the one important aspect is that the opportunity through the phased up approach is that we've been able to consider addressing our health and safety risks in a structured manner to start up the business with a very large workforce who are sparsely spread, and where we are unable to have full-on communications. Having a phased startup approach will allow us to go through the correct awareness training and the necessary preparation for us to get going in operations in a safe way. So maybe then moving on to the COVID toolkit. If we can, sorry, go back. We've developed a comprehensive toolkit, which is focused on ourselves and our contractor teams. Part of this toolkit is we've realized that it would be obviously best practice or first prize for us to be able to start the operations as soon as we can, albeit in a phased approach. And so the pre-screening of our employees is critical. We have developed a pre-screening mobile app. It can also be used on a desktop. And in essence, the app allows us to gather information. It can be completed by the individual, or it can be completed by one of the frontline supervisors or managers to help us actually gather information around our employees and understand who may be vulnerable, who may have compromised immune system based on their historical medical status and any pre-existing conditions. And then furthermore, we've been able to see where we need to assist our employees who may have been in contact or may have been exposed to COVID in terms of our operational structure. So the next slide, I think that Thomas was showing you, was just an example of what this app looks like. It's incredibly simple. I think it's important to understand that we have a workforce who speak multiple different languages, who possibly may not understand questions which are too complex. So what we've done is we've really made it very simple, and we've been able to ask a variety of questions. Yes, no, where are you completing it from? This has gone out to all our employees now. I think one of the challenges we have is that not everybody has access to Wi-Fi. Not everybody has, in fact, got a mobile app, but we are relying very heavily on our teams of operations to assist each other in getting the app sorted. That then provides us, and there's an example of the kind of information that would come in, and it provides us with useful information. So that helps us prepare for what we need to prepare. Our toolkits also, sorry, Thomas, I'm going through the slides quite quickly because I've got limited time. Our toolkits focus a lot on training. We have developed very simple training material, which we are now training all our frontline managers on, which will assist us in starting up, so that when we arrive at work, we are able to and not spend too much time having to train employees, that we are pre-trained. And so every frontline manager, supervisor, foreman, team leader will be responsible for ensuring that his team of people have been trained and are aware of the various SOPs and the change in the SOPs. We've also been fortunate enough to extend that over into our stakeholder and into our communities. So that same toolkit with the same pre-screening is being used in our community environment to provide support there. Other interventions is the sourcing of the PPE and health services. We are, like the first speaker, we are using flexible procurement strategies. We are buying local. We are trying to assist in trying to make sure that we keep local businesses going. So, and also obviously the logistics of sending out PPE across our country is obviously not that feasible. So we are also busy with the mobile clinic, procuring that so that it can move into our various environments and continuously provide the medical and health support to our employees. Communication remains a challenge. It remains a challenge primarily because we are so sparsely spread. We do not all have access to Wi-Fi with different languages. So we are using multiple communication platforms, and we've used a toll-free support line. This has been very successful. So employees can phone in, contractors can phone in. We are running this internally, and we can provide them with contact numbers, details, information on payroll, and that has worked really well for us. So if we can go and move on to the next slide. I think our transport is an issue. We are very clearly going to have to understand the risks associated with the SOPs on our labour carriers, and we have got a load factor on our labour carriers, which means that we're going to have to do a lot of planning around how we get our employees to and from work. The load factor is being stringently applied in terms of the SOP for our labour carriers. And obviously the public transport is a challenge, and we are going to need to consider how we're going to mitigate the risks related to the public transport for many of our employees. And then I think lastly, one of the most important aspects is nutrition. We feel very, very strongly that our employees, the health and welfare of our employees is critical. We have multiple options. We've got feeding schemes. Fortunately, we've got food gardens that our communities are running, and we want to ramp these up with the ability to invest a bit more, ramp these up so that our community food gardens can actually provide additional feeding for both our employees and their families. And similarly, we are looking at distributing nutritional products to our employees to ensure that their immune systems are kept intact, to ensure that their productivity levels are maintained, and to assist them, quite frankly, in terms of being able to fulfill their function. So, sure, I think in a nutshell that those are just some of the interventions we've been busy with, and I'm not sure that's it from my side.
Okay, thank you very much, Gretchen. Very insightful and very impressive response toolkit. I think for the sake of efficiency, we will move on directly to the next presentation. And I understand you will be happy to answer questions in writing. So thank you very much, Gretchen. Now I'll give the floor to Deroy, who's director at IBIS ESG Consulting, based in Nairobi. IBIS is an African sustainability consultancy that assists private and public companies to improve their environmental and social performance. So Teddy, the floor is yours about the COVID response you're supporting.
Thank you so much. Thanks IDH, thanks Mirova and Proparco and FMO for organizing this seminar and giving me the opportunity to speak. Can you hear me okay?
Absolutely, yeah.
Okay, fantastic. So yeah, quickly about myself, and please open up the presentation with the slides. So my name is Teddy Deroy, and I'm one of the managing director at IBIS ESG Consulting. I'm based in the Nairobi office. I've been in the environmental and social space for the last 17 years with a strong focus on occupational health and safety. For 2 years, I was the EHS manager of a small oil and gas company in a remote part of DRC. And in this part, had to deal with, of course, malaria and cholera, but also 2016 yellow fever outbreak. And I was in charge of, looking after the safety and health of 1,000 people workforce and managing the local clinic. At IBIS, we, since the beginning of the COVID-19 outbreak, we've been supporting a number of clients on organizing themselves on occupational health and safety, business continuity planning, community response, etc. So pleasure to be here today. Pleasure, Gretchen and Gerome, to be a speaker with you. It's good to connect again. Next slide, please. Cathy, can you move to next slide, please? Thanks very much. When you're dealing with occupational health and safety, there's a number of approaches that can be taken, and they usually organize around supplies and equipment, systems and behavior, and they go hand in hand. It's not just for emergency planning as the one of COVID-19 currently, but that's general. What I've put here a number of examples of actions that agricultural and forestry companies are currently taking on occupational health and safety as a response to the COVID-19 outbreak. And that should echo some of the good practices and learning we've heard already from the last webinar, with the example of the Ebola outbreak in Liberia, but also the ETG and MTO presentation. I won't go through every of those actions. I will rather choose a couple of them to do a bit more deep dive on what can be done. So if you can move to the next slide. The first thing which I'll be keen to share with this group is really on the medical facilities. The reason is one of the key characteristics of forestry and agri company in Africa is that they usually operate in very rural areas, quite far from the main cities and the hospitals. Very often, and the private company that are attending this webinar, I'm sure will agree, very often those companies are running their own clinic, sometime with allowing access to local communities in addition to their employees. And those local health centers are often the only one that are going to be available. We've all heard about flattening the curve and how the health system should respond to the crisis. Well, those small clinics are often the only one that are available. So there's a number of measures that should be implemented for those local health centers, because they will be at the heart of your response to the outbreak. First, if you can increase the capacity, sorry, I'm still on the same slide number 4, thank you. Increasing the capacity For example, through some collaboration with other existing health centers is really advisable. I was recently chatting to a forestry company that operates in Central Africa, and they have their own clinic. However, they've managed very rapidly to provide electricity to another local hospital and make it more operational in the context of this crisis. So that's a first thing to do if possible. Then you need to look at the stock of masks and critical supplies such as gloves, etc. And making sure that strategic stocks are maintained at the local health center. This is because your health worker will really be at the front line when the number of cases increase. In your jurisdiction, it may still be the 1 to 2 digits number of cases, but if things become more severe, those health workers need to be protected. Of course, ICU beds are generally not available at those local clinics. However, ordering some oxygen canisters and respirators is already very helpful to deal with the breathing problem that are induced by the COVID-19. You need to maintain those social distances within the premises of the clinic. So, for example, in waiting rooms, making sure chairs and benches are kept apart from each other. One challenging aspect is to make sure that this local clinic has enough beds to welcome the patients that will need some care. So you will need to organize the welcoming of patients slightly differently and making sure that non-critical patients are actually not directed to the clinic, but for example, to a separate building, or if you've set up a tent. The non-essential patients the essential patients that are allowed access to the clinic should be the vulnerable people and the one with COVID-19 symptoms, but of course, keeping in mind that you will still have your local health staff will still have to deal with medical emergencies. Posting posters, that's an easy win to know any visitor to the clinic about the COVID-19 rules. The question of mask is an interesting one, and I will come back to that at the end of this presentation. But surely it's already recommended that patients accessing the clinic wear at least cotton fabric mask, the reusable one. We see many of them being manufactured across Africa, and they are recommended to be worn. There may be some thought to be given to the access rules for clinics. Quite often, workers and workers' families are the benefiters of those local health centers, but sometimes communities and officials. Because this capacity of your local health center is going to be so challenged, there may be a need to review those access rules and explain them to the workers. And sorry to finish on this, but the mortuary setup may also need to be reviewed in the context of the outbreak. Those are a few recommendations. Those local clinics won't compensate for the lack of local health infrastructure, but they may help you to save some lives. So they really need to be looked after. Next slide. The second topic, which I am very keen to discuss with this group, next slide, is the question of behavior. And there were many questions on this aspect from the last webinar. Changing people behavior is the most challenging approach, the main challenge. that is happening with regard to responding to such health crisis. Of course, getting the right equipment, supply chain is an issue, but it's manageable generally, and getting the right systems and plans is also slightly easier. Why are behavior such a challenge? Because the workforce that is generally employed within agri and forestry company has generally low level of education. The way they live outside work, maybe with completely different rules than the one that they have at work. And also, we're dealing with human beings, and I won't develop the full psychological aspect of human behavior here, but I just want to insist on the fact that human beings tend to react to situations where the effects are immediate and harmful. If you look at those pictures in the center of this slide, what you see to the left is a very typical situation that you can see everywhere in Africa. Even in the most informal workshop, welders will protect their eyes. And why is that? Because if they don't, it directly harms them. They see the consequence of they are temporarily blind if they get exposed to welding. Whereas for the next pictures on the right, you see this gentleman smoking, this group of friends enjoying a glass of palm wine. The harmful effect of cigarettes or alcohol are not immediate. So people tend to be a bit more precautionist. That is exactly the same for virus, because we don't see them, and until you see a lot of people being infected, people don't tend to adopt the right behaviors. So what to do about this? There are generally 4 types of actions that can be done to work on your workforce and contractors' behavior. First, it starts with the top, and there needs to be very visible safety leadership from senior management, adherence to social distances, the way social management should participate to trainings and communication to the workforce, wearing masks, wearing gloves, etc. The leaders of the organization are going to set the standards. Then the leaders of the organization won't be able to be everywhere all the time. So they need a good team around them. And a good practice is actually to train some COVID-19 champions, people who have better understanding of the health risk of COVID-19, of the mitigation measures that can be deployed within the teams. Sometimes health and safety supervisors or employee representative, those people need to receive a bit more training to leverage senior management efforts. The third aspect is it is key to recognize good behavior. It's general for safety, but it tends to be very punitive. Okay, please do not have accident. Don't get sick. Don't get hurt. And it's always punitive. Well, a lot of employees will adopt the right behavior. We comply with the procedures, and this needs to be recognized. And finally, there's the efficient intervention. And there, I would like to use a very quick case study to show you what efficient intervention is. Can you move to next slide? Let's take this situation where a group of employees from a palm oil operation somewhere in Africa is just waiting for the transport after the shift to go back to the camp. As you can see, they're all close to each other. They're not wearing masks. Next slide. So what typically happens when the supervisor turns up? Next slide. Well, it's a lot of blaming, reminding about the need to wear masks, reminding about the need to maintain those social distances. There may be some very rude words mentioned on this occasion. And then what happened next? Next slide. The employee will start wearing their mask and will implement some social distance. Next slide. However, this is completely unsustainable. As soon as the boss is away, they will go back to normal. And
be careful, Teddy. I think you went on mute.
yeah. Can you still hear me? Sorry.
Yeah, that's fine.
Very good. So shouting at people, and especially adults, is not a way to change their behavior. Next slide. So now, what is efficient intervention? Let's take the same situation. The boss turned up. Next slide. We'll call an employee and, of course, show his safety leadership by wearing his mask. Next slide. Then we ask, look at your colleagues and tell me what you see. Next slide. Well, the employee may be a bit impressed and not really sure what to say. Next slide. Then, as a manager, we'll guide the employee to look at the right thing. What about them being too close to each other? Next slide. Then usually the employee will remind about the training that he had, you know. Oh yes, of course, there's some social distance, we should wear our mask and those type of things. Next slide. Then the manager will guide him through another question and ask him, why are these important? Next slide. Well, then it becomes some very personal consideration. You know, we all have families and kids. We want to say it's fit for work, those sort of things. Next slide. So then the manager can further guide. Yeah, so I agree with you. Why don't you go and repeat to your colleagues what we just discussed? Next slide. And then the employee will share with his colleagues what he has just heard. You know, this COVID-19, the mask, the need to pay attention to family and kids. Next slide. They will wear their mask and implement some social distances. Next slide. And when the boss have left, then they will remember, each one of them, those good practices that they need to implement. So what is efficient intervention? Next slide. For efficient intervention, it just recognizes that senior management cannot be everywhere all the time, and especially for large operations like agri and forestry, the agri and forestry one. The efficient intervention does not require more time. It's still in a couple of minutes. The management of a company can achieve much more sustainable behavior changes. And that works in all cultural contexts. It's just to empower the employees. And it works with 4 questions. First, help them to see the same things that senior management is seeing. Then helping them, you know, what about these specific things? Draw their attention to what is an issue in terms of behavior. Then make it very personal, asking them why those type of social distances, wearing masks, etc. are important. And then empowering them to engage with their colleagues. So this is efficient intervention, and it's very relevant in the context of a crisis. Next slide. Thank you. So in the following materials that I will share following this presentation, there will be one slide on the type of mask that can be the cloth mask or the cotton fabric mask that can be made for communities and employees. There's now a number of standard and guidance documents. We include some of them in French, some other in English, on how to manufacture and maintain and wear those masks. Thanks, everyone.
Okay, Thank you very much, Teddy. Very insightful and practical presentation. Thank you. I trust everyone will find it very, very useful. I think you, for Gretchen, you will answer probably most of the questions was asked in writing. There's just one I wanted to pick as a transition. It has been asked, can information materials and network from companies also be used in a broader sense for communities? And I think block 3 will answer that question. So Ninke, I'll give you back the floor to introduce the third session.
Thanks very much, Gretchen. And if we can move on to the next slide, then we can see the speakers there. So now we're going to move into a bit of a panel, but we did ask the speakers to first present themselves with a 2-minute presentation. So each 2 minutes sort of pitch will be followed by 2 questions so that we have a bit more interactive session. The first pitch and presentation will be of Mr. AC Nana Sekyiamah. He's a regional director of ECOM SMS, Sustainable Management Services in West Africa. AC, can I ask you to take over from here? And Katie, yes. Can you move the slides?
Hello, everybody. So as you can see, it's Miss and not Mr.
Sorry.
You got to buy me a beer next time I'm in Amsterdam.
I owe you one.
Yeah. Pleasure to be here, and thank you, everybody. So my name is AC Nana Sekyiamah. As you saw, I'm the regional director for ECOM Sustainable Management work in West Africa. So I'm going to talk just very briefly about what we've been doing in Ghana and Cote d'Ivoire since the COVID outbreak and the various moves that various countries have taken to try and contain and manage the situation. So we broadly work in about 4,000 communities in both countries, across both countries. At the time of lockdowns, and these happened at different times, we had direct access to about 40% of the communities in which we worked actively. What we are doing is, well, maybe before I talk about what we're doing, the approach we basically took, and I think everybody has taken, is that first, we wanted to make sure that our staff was secure, and then second, also to make sure that the farming communities in which we work were safe. So the staff part, I'm not going to talk about that. In the field, what we did was we leveraged our access and trusted relationships to provide communities with reliable information, leadership, products and tools to help fight the COVID outbreak. Next slide, please. I'm going to skip through this very quickly, but at a high level, basically what we did was we worked with our field agents to train them so that they were reliable agents of information, as it were. We also taught them how to interact with farmers and community members, being safe. Then this was largely focused on the communities in which we had direct access. For the communities in which we had indirect access, what we did was we shared COVID safety messages with influencers through WhatsApp platforms, phone calls. We experimented also with delivering messages through audio messages. As well as this, we worked with various government agencies to put out products and to support communities directly to develop tools to help manage, hygiene, basically. So in Ghana, we distributed 1 million bars of soap to all cocoa communities, and we leveraged across the 2 countries field agents to support communities to construct tippy taps where possible or other means of managing hand hygiene. Next slide, please. So some notes, lessons learned to date, and pictures. So for direct access communities, again, this was really very easy because we do a lot of training in these communities. We are seen as trusted sources of information anyway, and as change agents anyway for our normal work. It was relatively easy to convert this structure to be a structure that delivered COVID-19 messages and also showed people what to do, as it were. We, like I said earlier, support community leaders to implement and encourage social distancing. So we kind of lent our trust image to community leaders as well to encourage community members to behave in a way that was safe. For indirect access, the audio messaging experiment that we did, what we've done so far, we've pushed out an 82-second message, COVID message, randomly delivered. That's at different times. 75 seconds of the message, 75 seconds was the message, and so we had a 7-second quiz at the end of the message. What we saw was 100% pickup, but then by the time you got to the 75th to 82nd second, you had like a 50% drop off. So we're actually going into a second round of this test. And some of the things we're taking into that round is to shorten the message, change the placement of the quiz, and the quiz is important to us because it shows us that people have listened and are engaging with the material. Make sure that we use a familiar number, make sure that the recipient has prior knowledge of the call because a lot of people felt it was like some sort of scam. And then again, target the delivery times to make sure that people, you have mind share, as it were. I'll stop there with the little last two pictures that you see, the tippy tap, structure and with the bars of soap. Thank you very much.
Wonderful, great. That's really interesting, AC. Thanks so much. Maybe as a first question, so how do you see this? Because we were discussing this topic of behavioral change. Are you also measuring that? Or are you informed about what the effectiveness of these messages are beyond measuring, of course, the response? And not meant in a critical way. Yeah? I think this is great that you're doing this, but just to put this challenge in a central place.
Yeah. So, I mean, we've pushed out various messages through various platforms. Clearly, and again, this has all been in a relatively short amount of time. So, to reference back to the earlier point about how long it takes for behavior change, what we've seen is that we've seen the most immediate change along the pathways that people are most familiar with. So, with the agents, that obviously gives us the highest change. For groups of influencers where we have prior practice of sharing change information, we see that being the next level of change. The audio messaging has, as of now, been the least I think the least measured and the least pathway of change, even though we did a survey afterwards. The recipients have said that this is great and they'd like it to continue. So we think it's, particularly for the audio messaging, it's hopeful, but as of now, it's probably in the short timeline that we're looking at, it's probably not the most effective.
Great, thanks very much. Then maybe as a final question, through these current outreach activities, which are the groups that you think you are sufficiently reaching, and which are the groups that you feel continue to be left out?
So that's a good question. Again, because of the nature of the interactions, the groups that we would normally reach would be the same groups that we are normally reaching, particularly in the direct access areas, because in the direct access areas, we're leveraging our field agents. The field agents, as you know, are interacting with farmer groups, however composed, whatever percentage of women, whatever percentage of men. But of course, it depends again on the communities. We have some communities where they've limited group meetings naturally, right? And so in those group meetings, if you have only men turning up, then the agent is only reaching those people, and the women are getting secondary information. These are one of part of the reasons why we thought to look at the audio messaging, because the audio messaging gives us the opportunity to reach people, like the full breadth of farmers that we work with directly, irrespective of whatever cultural or social biases that may exist.
Great, well, thank you again very much. And with that, I'd like to introduce our next two speakers, which are Kate Mathias. She's a corporate compliance manager at Miro Forestry, and for those that joined our previous webinar, you will certainly remember her. as well as Tracy Morse. She's expert on WASH, and she's senior researcher at Strathclyde University, but based at the University of Malawi. She has over 20 years of experience in promoting sanitation and WASH with the communities in Africa.
Thank you. Thanks. So maybe for those of you that don't know Miro, I'll just give you a little brief background. We're a very small commercial forestry and timber products company. We operate in Ghana and Sierra Leone. We have operate on approximately 16,000 hectares of sustainable plantations. Those differ slightly in how they are based. In Ghana, they are previously owned Forestry Commission land, leased from the Forestry Commission, so slightly separate to the communities. But however, in Sierra Leone, we directly lease from the community, so our operations are very central to the community life, which I think is quite important in this discussion. We have approximately 2,000 workers. We are in the process of developing a smallholder project, but it hadn't quite got off the ground at the point of COVID when we stopped non-essential work. So it's kind of been put a little bit on the back burner at the moment. So the country position basically is, as you will know, and from the previous speaker, in Ghana, there was a lockdown. It's recently been lifted. However, there are still some restrictions. In Sierra Leone, also, there was a short lockdown. There are restrictions in place, but it is almost getting back to business as usual. Next slide, please. So Miro took a three-pillar action plan to tackle COVID. Pillar one being awareness raising, then moving to sort of reducing the exposure, and then responding to outbreaks. Next slide, please. The awareness raising has been the predominant part over the last couple of months, really. Looking really using our social teams and community liaison officers to build awareness in the communities around the workforce of what the virus is, what the practices we need to take to avoid contracting and avoiding the spread. We developed posters, we've done radio talks, and we've done film clips, one of which I'll show afterwards. Moved into sort of reducing the exposure, and we've developed some very dynamic, and I mean dynamic in that they're changing all the time. As my colleague from South Africa reported, you know, we're having to react to the changing environment. So our policies are basically being changed weekly at the moment. We've changed our working conditions. We try to implement a process that you know, people shouldn't feel forced to work in this environment. So if people had any concerns, they shouldn't work, and those with the you know, health risk and exposure shouldn't be working. We've tried to reduce the mixing of our communities, so we only have workers and people in the field within their local area, and we're working very closely with the local authorities because we recognise that we're very limited in our outreach to the communities. As I said, we don't yet have smallholder programs going, so we don't have a natural network of extension officers. We have a single community liaison officers that operate within a number of communities. So we are engaging now directly with the chiefdom and district and village task force to see where we can assist in their bid to try to contain the virus. And we are providing hardware and hygiene equipment to our own workers and trying to get it out to the communities in strategic locations. Then moving into the response side of it, very limited really. We don't have large clinics. We have a small clinic in our Sierra Leone operations, and we have a nurse in our Ghana operations. So we are looking to share the respond through supporting the local hospitals and clinics. We're looking to really focus on the frontline clinics in the communities to try to stop the movement of infected persons to hospitals if at all possible. Again, looking at the provision of hygiene and equipment and PPE to those clinics, and just continuing the messaging out to the communities to try to contain the virus. We are looking at what the impact might be on food security, particularly if we move into a lockdown situation, and particularly where we can't have where we haven't got workers. For example, we have in our industrial operations, we had to close our veneer planting in Ghana for a short period to rework it. It's opening again on Monday to sort of change the layout so that we can get the distancing in place. And for that period of time, those workers were furloughed. And there was a real pushback that they didn't want to be. They're out in the community. They were worried about their source of income. They were seeing some of their colleagues continuing to work, and we are paying during the furlough. And there was a big concern about food security. Equally in Sierra Leone, we originally closed canteen because we couldn't work out how we could get the distancing in place. It has been reopened because there was a big pushback again from the workers. We're seeing a lot of workers struggling to continue in the fields because they weren't getting that one good meal a day. So we have reopened it, but put in place distancing and shift patterns to be able to address that. So it's really putting to me the importance of addressing the food security, particularly if we move into a lockdown position. Next slide, please. So we've also engaged with some local tailors to produce different range of masks. We're testing them at the moment, and we're also looking at, how do you disinfect them to keep them clean and hygienic. And we have this short film of messaging that our Sierra Leone team put together, which perhaps you could show.
Stay at home. What does that mean? No social gatherings.
Be secure and friendly.
Coronavirus again. The two. I didn't diff. I put it from my body. I did sangi. The body no account of muscle.
But we can prevent this sickness if only we follow within masters and people, the government, the WHO, the tell me. Make we ensure say we wash your hands with soap and water frequently.
Practice social distancing. That means observing a safe amount of distance between you and the next person.
If we work together as one, we will fight and kick out this disease.
And we must be your subordinate. Then I take a kind of sweet.
If somebody sick, when we call 117. If somebody begin cough, somebody begin in nose they want, we all know this small signs or they show high fever when we call 117. Make we not take somebody go to herbalist to go treat them as within the help and move from the community.
So keep a distance, keep a distance. Thanks. Next slide, please. So we are a small company, and in particularly in Sierra Leone, we are the only company operating in that area. And I still have some concerns about how this is going to play out. Should the virus really take hold in these communities? So for us, keeping the business continuity, where possible, keeping the workers employed and the local economy afloat. We're already seeing issues where we're having to reduce the amount of workers because of the transportation limitations and having to have the spacing. This has a massive impact on the communities themselves because that's where we draw our workers from. The impact of any lockdown on the communities, again, we're really worried about the food security issues and just their ability to actually lock down and still survive. And we have some very real concerns around, if COVID-19 plays out in the way it has in other countries and attacks and affects the older people, the males, and the sort of sick and the vulnerable, what does that mean that our rural communities will look like, and what will that mean to the ongoing sort of sustainable supply on smallholder products, on food security, on land rights within the community? So, and then our biggest concern really is whilst we have workers in the factory and whilst we have workers within our care, we can offer some form of protection. We can offer, and we do offer hygiene equipment and support for them to be able to reduce their exposure risk. However, once they're back in the community, we have limited ability to influence the behaviours, and they are very communal behaviours, eating together, sharing facilities, sharing water pumps. So how do we help to reduce the exposure once the workers and our community members are in their home environment. Thank you.
Thank you, Kate. I was under the impression that it was going to be a combined presentation by you and Tracy. Apologies for introducing that in the wrong way.
That's okay.
We did receive a couple of questions, but I also realized that we are now running quite short in time. So if it's okay, I'd like to move on to Tracy and then see if we can run maybe 10 minutes over time maximum, for also leaving sufficient room for the presentation of Barthélemy and Gerome from MOPP and Earthworm. So Tracy, could I pass the word to you?
Sure, and I will try and be as time efficient as I possibly can be as well. So as mentioned, I'm actually an academic researcher as opposed to an industry person, but I have worked in sub-Saharan Africa looking at behaviour change around wash behaviour, mental health, and worked with the private sector throughout that time. And I wanted to just share maybe kind of a step back to look at what we should be looking for to focus efforts in communities and the key messages we need to keep in mind. Teddy and Essie have given some great examples already in the presentations today of how things can be done more effectively. So the key message I want to start with now is, like, where should we focus our efforts in communities? And what we often see people do is provide information. Here are leaflets, there's maybe radio messages, and now we're really surprised when people don't change their behavior. But you know, that happens no matter what country you're in, no matter what economic situation you're in, unless that knowledge and information is actually useful to you and you think affects you directly, you're not necessarily going to change that behavior. Similarly, we look at hardware. So often we give out soap or buckets, or we give better access to water, and equally we're surprised or perhaps disappointed when the behaviours again don't change automatically. And sometimes we provide those two things together, the leaflets, information and hardware, and still we don't see that effective behaviour change, because what we're trying to do really is often oversimplify what is an incredibly complex situation. If we could move to the next slide, please. So what we're looking at in terms of behaviour is something that's much more complex. It's not just based around having information and having physical things there. It's based around people's capability, and that can relate to their mental health and to where they prioritise the need to, example, wash their hands over using that soap to perhaps wash clothes so that they're clean to come to work, or use the soap for bathing so that they're allowed into work. And then there's also the elements of motivation as well. Sometimes those motivations are personal. Someone touched earlier upon saying, you know, I think for many of us, we see COVID, we hear about COVID, we see what's going on in the Northern Hemisphere perhaps. It's not impacting us perhaps in people that we know personally just yet in Africa. And the motivation therefore is to kind of, you're looking at this thing that may come or may not come. So where's the motivation to change my behavior? Maybe the motivation is there within the workplace because I'm required to do that in order to maintain my employment. But when I get home, that motivation is perhaps not there to the same degree. And then the opportunity requires me to have access to water, to soap, to hand washing facilities, for example, if we use that as a simple example. So it's an incredibly complex situation. So we can't just assume that providing knowledge and providing perhaps soap and buckets is going to lead to that behaviour change that we need. We've heard some good examples and some great learning, I think, from Essie already in this session about changing those messages that we're going through mobile messaging, which is fantastic. There are other simple ways we can do this. And we've also heard good examples today about how people can use trusted mechanisms for information. So if we already have through companies, cluster groups or farmer groups or whatever else, those are trusted mechanisms for giving information. Linking with health facilities and again, health workers who are trusted to give out that information is incredibly important. But we must bear in mind as well that a lot of these people also need capacity building, and where possible we should be supporting capacity building in nurses, community health workers, people who are doing outreach work, because they're not experts in COVID, and they're not experts necessarily in behaviour change or the hygiene mechanisms that we're looking for people to take on board. So we need to also build capacity in those people to do these things in the right way. And that needs to be supported at this time, because we have a degree of urgency here. We can't afford to do a 6-month behaviour change programme that hopefully encourages people to build their own tippy taps in the right way. We need to support that with can undertake the practice. If we look at this in a positive dimension, COVID is really giving us the opportunity to really hammer home some behaviour change around hygiene behaviours at domestic level, which will improve worker health and worker attendance and things as well at businesses in the long term. So we can see this also as grabbing an opportunity. So thinking about the systems, understanding the context in which people are living and working is incredibly important when thinking about what those solutions can be. Using the mechanisms available already through health workers, chiefs, landowners, etc. And building appropriate capacity would be the 3 key things to go along with that software and hardware that we can potentially do. So I'm trying to stick to my short time here. If we go to the next slide. I'm very happy to help with more advice or things in these areas with more detail and examples. But just to give these 3 resources, obviously things like WHO and CDC have fantastic resources, but there's also now a really great resource called the COVID-19 Hygiene Hub, which is led by the London School of Hygiene and a consortia, which gives great, very simple, straightforward advice to both businesses and for community engagement on hygiene interventions. So I think if I stop there for now, and we can maybe get questions at the end.
Great. Thanks very much, Tracy. And we did receive a lot of questions coming in through the chat. Just to highlight one, which is really focusing on this practical behavioral change. Can you give a concrete example where you say, well, this would be a good approach for promoting behavioral change that you've seen actually help in improving hygiene practices?
Yeah, I mean, I think working, for example, we work with very low literacy populations, and often my research work centres around caregivers and mothers within the home. One of the key things we've done is through health facilities, we do a really simple game where we use paint to put onto hands to demonstrate how bacteria can move or viruses can move from one place to another, because these are invisible things that people can't really relate to. And how you can perhaps scratch your nose and you see the paint move around, touch door handles, shake hands. And then using just simply water to remove that shows that the bacteria and things or the virus are still there on hands. Using soap and water then for 20 seconds is much more effective in then removing it. So it requires a little bit of investment in some paint and soap and water in a bucket. But if a health worker or someone who's doing outreach with groups can have those facilities with them, it's really visual, it's really effective, and people can see what a difference that makes in terms of effective hand washing.
Great, that's really nice and concrete example. Well, we'll certainly make sure to circulate the tools and links that you forwarded, that you included in the presentation for the benefit of people to reference to those.
No problem.
Additional questions came.
I'll also maybe just share with you a little module that we have on how to promote hand washing in households, which people are very welcome to use as well.
Great. Yeah, I was going to ask. We did receive a number of additional questions, so we'll forward those to you. If you could respond in writing, then we circulate those as well to all the participants. Wonderful. Thanks so much. Well, with that, we're moving into the final block of this community and smallholder outreach session. We still have Barthélemy Guisson. He's Senior Sustainability Manager at MOPP in Liberia, which is part of SIFCA Group, Ivorian investment group in the agricultural and forestry sector. And Gerome Topka, he's Regional Lead Africa at Earthworm Foundation. We're going to run, as I said, 10 minutes over time. So if you want to stay on, please do. And of course, the webinar continues to be recorded, so we'll also be sending that out. Thanks very much. Can I hand over to you, Gerome? And Barthélemy?
Yeah.
Hello.
Yeah, you're online, loud and clear. Thanks.
Okay, thank you very much. Yeah, thank you, IDH, Proparco, FMO, Europa for organizing this session. I think it's really, really informative, and thank a lot for having really thought about that. My name is Gerome Topka. I'm from Ivory Coast, but leading let's say 3 countries here, more or less, Ghana, Ivory Coast, Liberia, and very quickly to present Earthworm Foundation. Earthworm was previously TFT, the Forest Trust. We changed the name in January 2019, and we think that Earthworm is actually the best name for the work we are doing. Earthworm is a non-profit organization built on values, and also we are driving by the desire to positively impact human being and nature. So most of the people, more than 250 people, are working. 80%, more than 80% of the people working at Earthworm are in the countries where the raw material is. So the COVID-19 has really a big impact on our work, because most of us now are sitting, are working from home. We are not in the bush, and we are used really to be in the bush, working with people, doing implementation, because we work really on 3 pillars: implementing with companies what is going on, doing a lot of assessment, and from the assessment we can come up with innovation, and from innovation, of course, we try to scale up, we try to change, to transform really the business. I will give the hand to Barthélemy to present very quickly also SIFCA, and then we will move further.
Okay, next slide. It's okay. Okay, good morning, everyone. Good afternoon also. I'm Barthélemy from SIFCA Group, but based in Liberia. Just a brief overview. It's okay, huh? Right?
Yeah, we can hear you loud and clear. We got a really good connection.
Thank you. Okay. So just a brief overview of SIFCA Group. We are in 6 countries, 4 sectors: agri sector, rubber, palm, sugar, and recently renewable energy production. So the vision of the SIFCA Group is to stay as agro-industrial leader in Africa, and this COVID-19 really is a big challenge for our activities in the 6 countries where we are, and it's very important for us to take part of this webinar. So we thank IDH and the other partners for inviting us to attend this webinar. Thank you.
So very quickly, I just want to emphasize the fact that the first outbreak started in Wuhan, as we know, or in I think 17th of November 2019. And to be very transparent with you, we were really not prepared to the disease here in Africa. I mean, in the western part of Africa here, and we were confronted what the technology has brought to us in this last time is the social network. We are very good connected to each other, no matter where we are sitting around the world. But the other bad news connected to that is we don't need compulsory to trust information coming from the government, because we have our own source of information. So one of the challenge communities are, or community, I mean the population is really facing is fake news. And at the beginning of the process, a lot of people were saying, we are not concerned as Black men here, we are not concerned because the COVID, I mean, the virus is Black men are resistant to the virus and things like that, or it is a human disease and we are not concerned, and you know, or it is a punishment of God, and we are just to wait, like in Tanzania where the president is saying, look, we cannot stop working, we have to do our work as usual. And we have also a kind of mistrust. You have today a kind of, you know, inversion of influence. The information coming from the states is not compulsory the information people are listening to, because they have their own source of information. And sometimes is the information really the good information, or it is a wrong perception of information? That is a big problem we are facing too. And of course, from this mistrust, from the fake news, people are doing some auto-medication, like taking chloroquine without any, you know, way of taking it, taking leaves of some trees here, ginger, garlic, etc., etc. So we have this misperception that is sometimes different from the reality on the ground. Next slide, please. So what we at Earthworm are saying is this: we cannot be, you know, all experts in the COVID. And I don't think we have really expert now, because if we have experts, we should have the medicine already. So we have to listen to each other. We have to listen also to the recommendation of the state, of the country, because each country has set up now some measure, and we have to listen to that, and also work together hand in hand with the government recommendation, so that the people can really trust on the ground. So the first thing to address from our point of view is really to fight against the misinterpretation. We have to collaborate to each other, and we have to work with the nurses, the medical doctors, and also in the community, in the villages, work with elites, with the chief, so that, you know, what we will be saying will be something coming from the representative of all the group, not just from the company, not just from the village, not just from the administration and things like that. The second action for us is the preventive action, how we can explain really the disease to the community, because each region, each village has really its own, you know, local behavior, the culture are different, and people are reacting to the information very differently. So how can we adapt the preventive measure to the rural reality and work with the habit that people have already? And I'm very, very happy to hear that, you know, people are using, and it's something we are doing here in Ivory Coast, Liberia as well, you know, working with the local tissues to confection the masks. Because if you use the mask coming from the pharmacy, the thing is you can wear only 4 hours, and then you are polluting the environment because you are touching, and people do not have money to buy these masks. So working with really the fabric is for us very, it is a good preventive action, because you can wash this in hot water after that you have wear it. And the third action is really, how are the community prepared to the corrective actions? And this is the situation. We have to trust also the public health, the health centers in the company. But if somebody is sick, then we have to really make it known to the public health center, so that they can bring the people who are sick to the health center. So yeah, that the 3 key actions we think that in the communication process with community, we think that are very, very important. Next slide.
Okay, so thank you. Thank you, Gerome, for your insightful intervention. For SIFCA Group, let's say as a private structure, we can recommend what to do and sometimes how to do order for COVID-19 tests in case of sign appearance. But when it comes to monitoring and treatment, these are the responsibilities of the national health structure. So even if we have a facility in our group. So in addition to preventive measure for our workers and visitors, we have also we have taken some preventive measure action towards local communities, like how to help disseminate, government recommendation in rural areas for local communities. So we gave support to the local administrative authorities, giving them some materials, some equipment, like on your right on this slide, you see some equipment given to the local authorities to help implement the COVID-19 preventive measure. Also, we go on the ground with the involvement of the local authorities. We go on the ground to give support to some volunteers, spraying the preventive measures, and also we train them. We train some community leaders on the preventive action. So for Liberia, for example, the lesson learned from the Ebola cases is really a good reflexes remaining, and also some equipment, really some like a mask, a suit, or some spray equipment remain after the Ebola cases. So really, this really helped the company in the awareness action. Some donations also were made as planned, really, and the preventive measures in the communities are something really good for us, because we really take part of the action, and people are explaining really their view and their feeling. And as Gerome were explaining, right, we have really to listen to them and be able to help them give the right information, and be ready to support them in terms of giving the right information. So internally, we have some the newsletter, or we created some WhatsApp group, the mailing, the training, some sensitization internally. But when you come to the communities, it's a little bit difficult. So it's only the awarenesses, and also the group discussing. But we also have to respect the social distance and other things. In Liberia, for example, the state of emergency was stated, and the lockdown of four counties. There's county where the areas where we found more cases, COVID-19 cases. So the lockdown is stated, and we have to respect that. Fortunately, where our company is there, no lockdown, but really, according to we are close to Ivory Coast, we have to respect this preventive measure. So lastly, to hand, let's say, we give also support to really the community leaders to how to implement the preventive measures. So we train them, and we identify some of them where they can really help disseminate the information through their communities, through their people. So approximately, this is the action put in place by SIFCA Group in all the subsidiaries in the 6 countries, but also in Liberia where I am. So thanks. Next slide, Gerome. Okay. So Gerome can conclude.
Thanks very much, Barthélemy and Gerome.
Yeah, thank you very much.
Yeah.
I just want to say one of the the solution, because we African people, we love music, we love football and things like that, and I really appreciate one of the way of doing the prevention. The president of Liberia, who has a nice song, you can have us on YouTube. Sensitizing his people to really take seriously the virus and fight against it. I think it is very, very important. And they are also now included in the system, which is very important too.
Great. Well, thanks very much, Gerome and Barthélemy. And I think this was also a good reality check. So I think the main messages I got from this blog is that this knowledge and tools alone are not enough. We need to really approach trusted people in the community, let them experience things, and from there build knowledge. With that, I'd like to thank all the participants very much for joining in the webinar and for sharing their insights and experiences with us. We hope that this is really useful in spreading the word and also helping other companies that are operating in this field implement appropriate measures to limit spread of COVID-19 and also ensure business can continue where possible and in a responsible way. Again, thank you very much. I'd like to round off here. We also would like to highlight again our partners in organizing the webinar, Proparco, FMO, and Miro. Maybe as a final note, next week on Thursday, another webinar will be hosted. It will cover the same topics as we did today, but then in Spanish. So that will be focusing on the Latin America and Central America continent. Wishing you all well, stay safe, take care of each other, and thanks again very much.